Welcome back, everyone. I'm Dr. Khan, and today we're diving into a structure that most students literally just push aside during dissection to get to the good stuff. We're talking about the superficial fascia. Sarah, I feel like this layer is the unsung hero of clinical anatomy. It's like the bubble wrap of the human body.
That's a very energetic way to put it, Khan. I'm Dr. Sarah, and while I agree it's important, let's be precise for our students. In many textbooks, you'll see this referred to as the subcutaneous tissue or the tela subcutanea. For those of you preparing for board exams, remember, this is the layer that sits directly deep to the dermis and acts as the interface between the skin and the deep fascia that envelops the muscles.
Right, and why does this matter clinically? Well, if we didn't have this layer, our skin would be essentially shrink-wrapped onto our muscles. Imagine trying to move your arm if your skin was glued to the biceps. The superficial fascia provides that slip, allowing the skin to move independently. It's like the grease between the gears of the body.
Exactly. And histologically, we're looking at a mixture of loose areolar tissue and adipose tissue, essentially fat. Now here is a high yield point for the exams. The distribution of this adipose tissue is not uniform. Khan, you often see the clinical consequences of this, don't you?
Oh, absolutely. Think about the pot belly or the thickness of the fascia on the back versus the hand. But here's the cool part. There are places where the body intentionally leaves the fat out. Sarah, where should students keep an eye out for fat-free superficial fascia?
This is a classic accept question on exams. Adipose tissue is notably absent in the eyelids, the auricle of the ear, the penis, the scrotum, and the clitoris. If you see fat in a surgical specimen from the eyelid, you've likely migrated into a deeper orbital compartment.
That's a great pearl. Now, let's talk about the anchors. In areas like the scalp, the palms, and the soles of the feet, the superficial fascia isn't just loose fluff. It's packed with these tough bundles of collagen fibers. I like to think of them as the retaining pillars of a bridge. They tie the skin down to the deep structures so your skin doesn't slide off when you're trying to grip a doorknob.
Those are the retinacula cutis. And clinically, those anchors are responsible for the skin creases we see over joints. On the palms and the flexor surfaces of digits, the skin is firmly tethered to the underlying deep fascia. This creates fixed points of folding. If you look at your own palm right now, those lines aren't just for palm readers. They are functional attachment sites.
And from a surgical perspective, that tethering is why some infections stay localized while others spread like wildfire. Let's look at a carbuncle. The book mentions it's a staphylococcal infection of the superficial fascia, often starting in a hair follicle. Because of those tough fibrous septa in the back of the neck, the pus gets trapped in compartments, making it incredibly painful and requiring proper incision and drainage.
That leads perfectly into another high-yield topic, burns and skin grafting. Dr. Khan, when you're assessing a patient with a deep burn, the superficial fascia is your safety net for healing, right? Spot on. If a burn is partial thickness, we rely on the fact that the sweat glands and hair follicles actually extend deep into the dermis, and sometimes even into the superficial fascia. These appendages act as seeds for new skin cells to grow from. But if a burn destroys the full thickness of the skin and reaches deep into that fascia, you lose those seeds. That's when you need a graft. For the boards, make sure you differentiate between a split-thickness graft, where you take the epidermis and just the tips of the dermal papillae, and a full-thickness graft. In a full-thickness graft, you are taking both the epidermis and the entire dermis. The donor site then relies on that subcutaneous layer to be healthy enough to accept a secondary graft or to be closed primarily.
It's all about the blood supply. The superficial fascia is where the major cutaneous nerves and superficial vessels travel before they branch out to the skin. When you're suturing, you have to respect this layer to ensure the skin edges stay alive. As a clinician, becoming the doctor of choice for your patients means understanding the layers you're suturing through to minimize scarring and maximizing healing.
Very well said. Another high-yield clinical note involves the spread of fluid. Since the superficial fascia is often loose areolar tissue, it can provide a potential space. Think about edema or even the spread of certain infections. If the fascia is loose, the swelling can be massive because there's so much room for the tissue to expand.
Exactly, like in the scrotum or eyelids where there's no fat. Swelling there happens almost instantly because the tissue is so compliant. It's like an empty balloon waiting to be filled. Compare that to the scalp, where the fascia is so dense that even a large hematoma might feel like a small, hard knot because it has nowhere to go.
To wrap this up for the students, focus on the functions. It's a storehouse for fat and water, it's a thermal insulator, it protects against mechanical shock, and it conducts the neurovascular supply to the skin. If you can remember those 4 things, you've got the foundation.
And don't forget the clinical why. It determines how infections spread, how burns heal, and how we move. If you think of it as the body's functional padding rather than just fat, you'll appreciate it a lot more in the OR.
Let's summarize the top 3 takeaways. 1. The superficial fascia, or subcutaneous tissue, connects the dermis to the deep fascia. 2. Adipose content varies. It's thick in the abdomen, but absent in the eyelids and genitalia. And 3. Retinacula cutis are the fibrous bands that anchor the skin, creating creases and determining the mobility of our outer layer.
Beautiful. Next time you're in the lab, don't just scrap that layer away. Look for the nerves, look for the vessels, and appreciate the padding. We'll see you in the next episode.